Welcome to the Uzima Health and Wellness Podcast.
What did the doctor say?
Well, let me just say some of the recaps from me. The first one, the term post-traumatic stress disorder. The intersection, I'm an anesthesiologist, the intersection that we have sometimes with post-traumatic stress disorder, depression, and suicide is at the ECT room, okay? And so one of the things that I was wanting more was the statement that we do have the psychiatrist who was able to administer electroconvulsive therapy for patients who have really become debilitated, incapacitated, unable to do basic needs for themselves. If they've become, that mind-body separation could make them that incapacitated that they need electroconvulsive therapy. And that's a big discussion, and a big jump in therapy. We also, with the psychiatrists have, this whole stepwise approach to antidepressants, and then trying to decide if there's a mood disorder on top of these things, as well as if there's any type of maladaptive behavior. So we have this type of, psychiatrist, psychologist, and then you as a neuroscience helping us understand basically clinically driven and proven evidence-based medicine so that we can approach the patient not just out of witchcraftery, but more out of a scientific approach. I think that, so this whole, that kept coming up in your podcast. So I appreciate hearing both the politician and the scientist say those post-traumatic stress disorders. I mean, your your political scientist use the term a lot of this type of collective post-traumatic stress disorder, which also are experienced on during the riots. We never saw it before. We never felt it before. I think we all were aghast as a nation during that time. We also, and you almost have to think about the police officers that were out there who now are at risk of post-traumatic stress disorder. And you of all, scientists and physicians, we know that these type of events for someone who's experienced cumulative events or even this one traumatic event can put them at risk for substance abuse. Would you agree?
I would definitely agree. And the triggering is so high. I mean, that's one of the things that's so clear in the research. Once you've been through those stressors, it makes it that much more likely that, that you're going to be at risk.
And we also agree there's not enough psychotherapists around, and that this could also make them suffer in silence. With one of your guests, Dr. Alfie said, this thing of Doug Middleton. We actually gave him the title doctor. He's Dr. Middleton.
He's Dr. Middleton now.
so that basically you feel alone, that you're suffering in silence. And then I love the fact that you have sports men.
Hi, Uzima family. If you like what you're seeing and what you're hearing, subscribe to our channel. Hit the bell icon below to be notified of our recent videos. What did the doctor say?